What if the antibiotics we rely on suddenly stopped working? What if a simple cut, a routine surgery, or a common infection could once again become deadly? This is not a future scenario. It is happening right now. Antibiotic-resistant infections are rising across the world, and they threaten every one of us. Welcome to Health Arc, where we break down the science behind modern health challenges and explain what they mean for your daily life. Antibiotics are medicines that kill bacteria. They have saved millions of lives since the 1940s. But bacteria can adapt. When antibiotics are used too often or used incorrectly, bacteria learn how to survive. This creates resistant strains that normal antibiotics can no longer treat. The World Health Organization calls antibiotic resistance one of the biggest threats to global health. It already causes more than 1 million deaths every year, and experts warn that the number could rise sharply if action is not taken. The UK Health Security Agency reports that antibiotic-resistant infections increased by more than 2% in 2022. Many hospitals continue to see cases of methicillin-resistant Staphylococcus aureus, MRSA, and urinary tract infections caused by resistant E. coli are becoming more common in communities. These are infections that were once easy to treat. According to the CDC, antibiotic-resistant infections cause more than 35,000 deaths in the U.S. every year. One high-profile case involved a Nevada woman in 2017 who died from an infection resistant to all 26 antibiotics available in the country. This was a wake-up call that resistance is not a distant problem. It is already here. India faces some of the world's highest rates of antibiotic resistance. Studies published by the Indian Council of Medical Research show rapidly increasing resistance to drugs used for pneumonia, tuberculosis, and bloodstream infections. In 2018, New Delhi hospitals reported cases of Klebsiella infections that did not respond to even the strongest antibiotics. Antibiotic resistance does not spread only inside hospitals. You can spread in everyday life. Here is how it happens. People take antibiotics when they do not need them, such as for viral infections like colds or flu. Patients stop antibiotics too early, which allows surviving bacteria to become stronger. Antibiotics are overused in farming and livestock, and resistant bacteria travel through food and water. Poor hygiene allows resistant infections to spread from person to person. This creates bacteria that move fast through communities and across countries. Some resistant infections are now becoming familiar names. Methicillin-resistant Staphylococcus aureus, MRSA, which spreads on skin and wounds. Resistant tuberculosis, a major concern in India and many low-income countries. Drug-resistant pneumonia, which affects children and older adults the most. Resistant UTIs, especially caused by E. coli. Carbapenem-resistant Enterobacterales, CRE, sometimes called nightmare bacteria because they survive even the strongest antibiotics. These infections can make routine surgeries, childbirth, and cancer treatments far more dangerous. Here is what everyone can do to reduce the spread of antibiotic resistance. Do not take antibiotics unless prescribed by a qualified doctor. Finish the full course of antibiotics, even when you feel better. Never use leftover medicines. Practice good hygiene to prevent infections in the first place. Make sure children and adults receive recommended vaccines. Use antibiotics responsibly in animals and food production. These steps protect your health and the health of your community. Antibiotic-resistant infections are a serious threat, but they are not unstoppable. With responsible use, better hygiene, and strong public awareness, we can protect the medicines that protect us. If you found this video useful, hit the like button, share this with someone who needs it, and subscribe to Health Arc for more clear and science-based health explanations.